Today we're discussing the highly publicized deaths of Candi Miller, Nevaeh Crain, and Josseli Barnica. These are three women whose deaths were reviewed by maternal mortality review committees in Georgia and Texas and found to be almost certainly in one case and likely in other cases to be associated with the very restrictive abortion laws in those states. These are the second, third, and fourth reports that were published by ProPublica, and in the results, these committees, who are comprised of nonpartisan experts, found that it is likely or probable that these women would still be alive if not for very restrictive abortion laws in their states. These women were mothers, daughters, sisters, partners, cousins, friends, and their deaths were very impactful to their family. There is a very real chance that someone in their friend or family group could end up watching this video. So please be considerate of that before you go into the comments and start using them as a way to get across your negative sentiments about abortion. They don't deserve that. They don't need that, and that is not fair to their family and friends, because what we can do is discuss this in a productive and respectful manner without causing more pain to anybody's surviving friends and family. Let's jump into the video. Candi Miller grew up in Alabama. She spent most of her adult life in Atlanta, though, and that's where she made a living braiding hair and doing nails. She loved cats, she loved gardening, and her three kids today are ages 5 to 16, meaning when she died, she left behind a very young toddler and two children who were old enough to understand exactly what had happened. Her third pregnancy was quite difficult with her in 2022 now toddler, and her sister had said she never fully recovered from that. Reporting says that her doctors had warned her that another pregnancy could potentially make her so ill that she lost her life. She had lupus, diabetes, and high blood pressure at baseline, not to mention she's over 40, which makes pregnancy in and of itself more risky and makes delivery more risky. So in fall of 2022, when she found out that she was pregnant, she wanted to prevent outcomes that her obstetric team in the past had said were quite possible if she were to stay pregnant, which is increasingly making her more unwell or killing her. She was nervous about navigating the health system in Alabama, where Roe v. Wade being overturned had recently put Georgia's trigger laws into effect. So she ordered abortion pills online, and she ended up taking those in early November. I'll add in here that this is considered to be a safe manner of pregnancy termination. She didn't do anything wrong, and she did not do anything inherently unsafe, nor did she do anything that was be recommended against from ACOG. She, like Amber Thurman, did not expel all of the products of conception and ended up requiring a DNC. And recently she knew that under Georgia law, that was a felony except for certain exceptions. Her teen son, because she was likely afraid to seek care, just like Amber Thurman, for fear of being prosecuted herself or turned away, ended up staying at home, and he watched her suffer, according to his account, for days, bedridden and moaning, which is absolutely heartbreaking, until the early hours of the 12th of November, 2022, when her husband found her unresponsive in bed with their 3-year-old and ended up calling for help. An autopsy at that time found that she had retained products, and she also had a lethal combination of painkillers, including fentanyl. Now, Candi didn't have any history of drug use, and that had been verified by all of her friends and family. So it's not really clear where the fentanyl came from in this discussion, and is likely a topic unrelated but important. However, if she had obtained fentanyl from somewhere as a pain control measure, that in and of itself is something we should consider, because she didn't feel comfortable getting pain medicine from doctors who could give it to her legally because she was afraid to seek care. I don't know. It's not clear. However, what is clear is that she was afraid to seek care in her home state because of abortion legislation. And that is, in and of itself, the problem and the topic we're discussing. So the review committee that goes through all of these told ProPublica that the fact she felt like she had to make those decisions, that she didn't have adequate choices in Georgia, definitely influenced her case and the outcome, which was her death. Her family's understanding was that she was quite worried that she herself would be prosecuted and would face legal consequences, which which is reasonable that people would be worried about that. There is, I would say, not even a real clear delineation in most places of if that is something that is going to start happening. There's a really poignant quote in regards to Candi's life and death in regards to this case, and I want to just read it to you so I don't get it wrong. Her case adds to mounting evidence that exceptions to abortion bans do not, as billed, protect the life of the mother. This is so incredibly important. I have been saying this forever. Exceptions for life endangerment will save some people, but not everybody. How many of the not everybody is acceptable? To me, it's none. Her sister is quoted as saying that she was trying to terminate her pregnancy, not terminate herself. And my heart just sinks thinking of that, of her husband, her friends and family, her 3 children who now don't have a mother, and how people who put these laws into place saw that as acceptable collateral damage, and she had no choice in the matter. We'll move on now to discussing Nevaeh Crain, who was a pregnant teenager. I have gone through and read her story numerous times, but don't have quite as detailed of a synopsis, and I don't want to mess up the details. In short, she was pregnant and seeking care for what at the time seems to have been thought to be a non-pregnancy related problem, and over time was identified to actually be related to the pregnancy. But at the time where that was identified, there was a delay in moving forward with D&C, in part, if not in full, related to restrictive laws in Texas being unclear on how to move forward and what was okay and what wasn't, and she ended up dying. So I'll pull up her story here. It took 3 ER visits in 20 hours before she was admitted. Her condition then worsened. Doctors insisted on 2 ultrasounds to confirm fetal demise. Not really a fair assessment. I think that was probably a requirement for them in the legislation or the hospital. I'm not sure. We'll see if there's any more information on that. It would be weird to demand 2 ultrasounds to confirm that unless there was some legislation for that. So that's odd. Candace Fales screamed for someone in the Texas hospital to help her pregnant daughter. Do something, she pleaded, on the morning of October 29th, 2023. It's my son's birthday. So Nevaeh was 18. She was crying in pain, too weak to walk, and started having fevers and vomiting on the day of her baby shower. At that time, she obviously was carrying a pregnancy that was very much wanted, or she wouldn't have been having a baby shower at that point. She had gone to 2 emergency rooms within 12 hours and came home worse each time. And the first hospital had said, oh, you have strep throat, but didn't investigate her abdominal pain. The second, she screened positive for sepsis, which is life-threatening. And I cannot imagine why you would send somebody home with sepsis. And that was documented apparently in her medical records, but doctors said that the 6-month fetus had a heartbeat and she was fine to leave. That is alarming, 1, to send home somebody with sepsis, and 2, that you're carrying a 6-month pregnancy, having abdominal pain, now sepsis, and being discharged from the hospital. On her 3rd visit, an obstetrician insisted on 2 ultrasounds to confirm fetal demise, a nurse wrote, before moving her to intensive care, which I know it's required to have a second ultrasound in Texas to have an abortion, and you have to have it like an ultrasound and then 72-hour time frame before you can proceed with abortion, but I'm not sure what this is, if this is just that person or what. That doesn't make any sense. You should be able to easily confirm fetal demise with a single ultrasound. I totally understand wanting to have like a second doctor look at it, but there should not be a delay in care for that. So that's problematic. But then 2 hours or more after her arrival, her blood pressure was plummeting. Nurse had noted her lips were blue and dusky and organs had begun failing, which we discussed in other discussions of this with Amber and Candi, is likely a reference to renal failure or injury. And a few hours later, she sadly died. She would have turned 20 this year, and she, the mother of Nevaeh, is baffled as to why she was not treated like it was an emergency. And they go on to talk about pregnant women becoming untouchables, people being afraid to investigate and intervene, that abortion bans threaten prison time for interventions which end a fetal heartbeat, and that doesn't matter if the pregnancy was wanted or not, includes exceptions for life-threatening conditions, but still there is confusion and fear of potential legal repercussions, and that changes the way that you interact with patients. 100% that. While I don't agree that you ever should take that into consideration higher than the patient, that's not consciously what's going on here. These people are scared that they will be prosecuted. And anytime you are scared, you will be prosecuted. You are going to act slightly different. It's the same way, like I don't really like taking care of people that I'm really close to while they're pregnant. It's just so hard to objectively follow exactly what should be done medically when you've got some other connection that is not just, let me be the best doctor I can be. And that is the exact same thing that happens here. Sometimes they're bounced between hospitals like hot potatoes, and medical teams are wasting time debating legalities and creating documentation. 100% that. Precious time is being lost to delaying care, hoping someone will get better, which again, I will say, most of the time they will, most of the time they won't die. So you do that a few times and you're like, okay, well, I'll just keep doing this, and eventually it kills somebody. But I want us to really refrain from going, the problem is the doctors, because it's not. And how can we even know if maybe it is in this case, but without being able to remove the legislation from that, we can't know. And so not only does this legislation lead to deaths like this, it leads to people who are probably shitty doctors not even being able to be weeded out, because we don't know what the reason was here. And it could have just been shitty doctors, but it's not going to be that in all of these. And it also could be unnecessary restrictions. And that's a problem as well, because then these people keep practicing if they actually were the problem. And some said that the warning signs of infection deserved attention, and all of them said the doctor at the second hospital should never have sent her home, which is pretty well my assessment when we were going through this the first time. And I only have kind of the secondhand information that ProPublica has put in this article. And then when she came back for the third time, everyone said there was no reason to make her wait for another ultrasound before taking aggressive action to save her. Now, importantly, she was 6 months pregnant, so it is also quite conceivable to me that she would have been in a facility where there was nobody who could have even provided the care that she needed, which would have been at this point a D&E. Whether the fetus was alive or not alive wouldn't have mattered. The fastest way to take care of this would be dilation and evacuation, and I wasn't trained in that in Texas. And most of the hospitals I worked at would have had nobody there who could do that procedure because of that. So this documentation of, we need to wait for another ultrasound might have just been that, but it also might have been, there's nobody that can do this procedure here, and she's too unstable to transfer somewhere else. I don't know. That's speculation. There's a lot less clear information in this one than the previous two that we reviewed. While it's not certain from looking at the records provided that Crain's death could have been prevented, they said it may have been possible to save both the teenager and fetus if she had been admitted earlier for close monitoring and continuous treatment. Reasonable. There was a chance Crain could have remained pregnant, they said. If she needed an early delivery, the hospital was well equipped to care for a baby on the edge of viability. In another scenario, if the infection had gone too far, ending the pregnancy might have been necessary to save Crain. Fales, her mother, and Crain believed the abortion was morally wrong. The teen could only support it in the context of rape or life-threatening illness, she used to tell her mother. They didn't care whether the government banned it, just how their Christian faith guided their own actions. When they discovered Crain was pregnant with a girl, they talked endlessly about the dresses that they could buy and what kind of mother she would be, and landed on the name Lillian for the baby. They could not wait to meet her. But when she was sick, Fales, Nevaeh's mother, expected doctors to have an obligation to do everything in their power to stave off a potentially deadly emergency, even if that meant losing Lillian. And they do, but sometimes it's not in their power if blanket legislation has led us to this point. In her view, they were more concerned with checking the fetal heartbeat than attending to Crain. Okay? That is why this case, which can far less definitively be directly linked to a lack of care due to abortion restrictions. That is why this matters, because these restrictions and this culture create and propagate the culture that the important part of people who are presenting to a medical facility while pregnant is the fetus and not the person who is carrying it. Priority is going to assessing the fetus. So when they said like she was sent home because the fetus still had a heartbeat, she's still incredibly unwell. So whether abortion would have been what they recommended or not, they aren't taking appropriate care of her. And that is related to this culture of valuing a fetal life higher than the person who's carrying it. And that is absolutely something that is much easier to justify both to yourself and the people around you, even if you don't overtly know that you're doing it, when these kinds of legislative actions have been taken already. I'm just briefly coming through here. So she saw first a nurse practitioner, ended up being diagnosed with strep throat, but in a pregnant patient, abdominal pain and vomiting should not be quickly attributed to strep. A doctor should have also evaluated her pregnancy. She was sent home with antibiotics and woke up still hurting. She went to another hospital and had a temperature of 102.8. a high pulse, and abdominal pain quoted as 7 out of 10. Under no circumstances would I ever send a patient home with that presentation. Possible sepsis, arguably definitive sepsis. I think she would fit the category of sepsis with tachycardia and significantly elevated temperature and a known infection. Standard medical practice would be immediately treating a patient with sepsis and keeping them in the hospital. Find the source of infection. If it was the uterus, then she either needs delivery or termination depending on circumstances. They checked on the baby, said baby's fine, gave her IV fluids, antibiotics, and Tylenol. She was still tachycardic, meaning her heart rate was too high. Her fever had not improved, and there was fetal tachycardia, and she was discharged. That is not how I ever would have managed this, and that description is damning for whoever managed her that way. I'm not sure if I could say the doctor was at fault, but this one is much more clear to me that this is not appropriate medical management. Now, whether or not that would have been the case if the culture didn't value fetal life above maternal, I don't know. It is shocking to me that she would have been sent home at this point. And again, that doesn't really matter, right? It does, but in this conversation we're having, it's not, see. It's how do all of these things interplay? And the truth is they interplay by creating cultures where things like this can happen. So this doctor has had some other issues, and this gets to what we were saying a bit earlier about when you have these restrictions and then we start making it unclear whether this is malpractice or related to abortion restrictions, you're getting this muddy water of how do we distinguish what is the cause and effect here. All of the doctors who reviewed Crain's vital signs for ProPublica said that she should have been admitted. When they discharged her, they were pushing her down the path of no return. It's bullshit, Fales said as Broussard rolled Crain out in a wheelchair. She was unable to walk on her own, had expected the hospital to keep her overnight. She was breathing heavy, hunched over in pain, pale in the face, normally talkative, but the teen was quiet. 7 a.m., she was crying, she couldn't move, she started having bleeding, went back to the hospital, was in what sounds like septic shock and critically ill, and bleeding, having contractions, getting a second ultrasound. I don't know. I'm not as sold on this potentially being related. And I'm also confused about the need for a second ultrasound. I do think all of these things overlap, but I think this one I would say is absolutely possibly related, but far more impacted by the failure to keep her in the hospital at the time when she was quite clearly septic. Okay. Wow. That's heartbreaking and complicated. And I had read through this, but must have missed the part where she was clearly septic and discharged. So I think it is all related still. I think it is all confounded, but she should have never been sent home when that first diagnosis was made. So Josseli Barnica, she would have been around 17 weeks pregnant. She was in Texas. This happened in 2021, and she had a daughter and was very excited to be pregnant and for her daughter to have a sibling. She had something called either premature labor, incomplete miscarriage, cervical incompetence, early cervical dilation. It is difficult to tell from the information we have exactly what it was, but basically at 17 weeks, her cervix was dilated. The medical team was saying there's nothing that we can do at this point that will prevent you from losing this pregnancy, but she also was not offered anything to make the miscarriage happen faster. This is a point of discussion because 100% in this scenario where it was inevitable that the pregnancy would be lost and there was no acute event threatening someone's life, even in my training in Texas, where we didn't do elective terminations, that would have been a situation where we said, we can give you medicine to make this happen faster in order to basically keep you from having to suffer for longer. 100% reasonable for people to say, no, I just want to wait and let it play out naturally. But for sure, standard of care to offer intervention at the point that you know it's inevitable. Her husband came in to be with her in the hospital, and he had told the medical team that he was coming in to take care of her, and they had said to him that they couldn't do anything until there was no heartbeat, and it would be a crime to give her an abortion. This is 100% accurate. She is not currently, at least from what we've been told, in any kind of life-threatening situation, but this is a situation that can become life-threatening. So I don't think there's any Texas OBGYN who would say that is not a situation where I would be afraid to intervene. We all would, because there's no acute threat, and that's the law. They say for 40 hours, she prayed for doctors to get her help, and her uterus remained exposed to bacteria. They haven't said that her water had broken at this point, but so even if it hadn't, you're still at an increased risk because of the cervix being open and bacteria moving from vagina up into uterus. Increased risk of infection is always a risk. She ended up delivering, and a few days later died of an infection. ProPublica says that there was a delay in treating her miscarriage. I would argue this was a delay in offering options that are medically indicated, common, reasonable, but also clearly not allowed under current Texas legislation. HCA in Houston did not respond to requests for information, but said that it is our responsibility is to be in compliance with applicable state and federal laws and regulations, and said that the physicians exercise their independent judgment. That is the problem. Hospital, not gonna back you. Why? What did they just say? Our responsibility as a healthcare system, as a hospital, is to be in compliance with applicable state and federal laws and regulations. That is saying, if you decide to go against the grain and offer intervention, even though it would be probably by a group of your peers found to be not a life-threatening situation in that exact moment, I'm going to, as a hospital, say, not my problem. Our responsibility is notably not the best care for our patients. That's not what they said. Our responsibility is to be in compliance with laws and regulations in our state. And then physicians exercise independent judgment. This is exactly why we can't do things, even if we know it's the best thing for the patient, when the legislative system, the judicial system, the court of public opinion, and the hospital system are never going to back you. They went through all the information they could find with experts, and after reviewing the summary that they found, including the timeline of care noted in hospital records, all of those experts agreed that requiring her to wait to deliver until after there was no detectable fetal heartbeat violated professional medical standards because it could allow time for infections to take hold. There was a good chance she would have survived if offered intervention earlier. Importantly, those doctors saying that does not mean these doctors did the wrong thing. These doctors were put into a situation by the state, put your doctor into a situation where they had to go against what is very clearly the most appropriate medical care, which is offering to intervene if that's what the patient wants, because they were threatened with persecution, felony, 99 years in prison, license being taken away, livelihood gone, inability to continue doing this job that you love. That's not okay. The government should not be putting your healthcare provider in that situation, and it is not the fault of these doctors for not offering that. It is a fault of the state for putting them in a situation where they can't offer that. Many noted a striking similarity to the case of Savita Halappanavar, the 31-year-old woman who died of septic shock in 2012 in Ireland after she was unable to have a termination at 17 weeks and was told that this was Catholic country and they couldn't do that. In the wake of deaths related to abortion access in the U.S., leaders who support restricting the right have not called for any reforms, which is, again, notably different than what happened in Ireland after these cases became public knowledge. This is not looking good. We can't keep reviewing these cases. And the legislators keep going, it's the doctor's fault, it's the doctor's fault, it's the doctor's fault. Really? Because I would say if it's the doctor's fault, we shouldn't see an increase in maternal mortality related to inability to access abortion. And we've already seen that. It's not the doctors. These are the same doctors that were doing this job before. It's the laws. Last month, ProPublica told stories of Amber Thurman and Candi Miller, whose deaths by the Maternal Mortality Review Committee were deemed preventable. as we discussed. And they also make reference to the case we just previously talked about, Nevaeh Crain, whose death is, in my opinion, slightly less likely to be directly linked, but certainly affected by the culture of care regarding pregnancy in the US, but particularly in places like Texas. Governor Brian Kemp called the reporting fear-mongering. Former President Donald Trump has not weighed in, except to joke that his Fox News town hall on women's issues would get better ratings than a press call where Amber Thurman's family spoke about their pain. Just like, this is the person not you, maybe you, I don't know, if you're watching this, you, elected to be president. Someone who cared more about ratings at his town hall than Amber Thurman's grieving family discussing the death of their young family member who left behind a 6-year-old son thanks to your Supreme Court and mission to overturn Roe v. Wade. I don't understand. Leaders in Texas, which has the oldest abortion ban, witnessed consequences of restrictions longer than any other state. 100% I was seeing this stuff before I even left Texas. In lawsuits, court petitions, and news stories, dozens of women have said they faced dangers when they were denied abortion starting in 2021. One suffered sepsis like Barnica, but survived after 3 days in ICU. She lost part of her fallopian tube. Lawmakers have also made small concessions to clarify 2 exceptions for medical emergencies, but even in those cases, doctors risk up to 99 years in prison and fines of $100,000. They can argue in court that their actions were not a crime, much like defendants can claim self-defense after being charged with murder. Is that really how we want your doctors to have to be practicing medicine? I would say no. God bless my family, Barnica wrote on social media, alongside a photo of the trio in matching red and black plaid. Our first Christmas with our princess. I love them. I can't. This is breaking my heart. She was very happy to be pregnant again. 17 weeks in, went in. We discussed what they saw at this point. Miscarriage was in progress. She was dilated to 9 centimeters. 9 centimeters. Absolutely 100%. Under no circumstances is it appropriate that she could not be offered to expedite this. But legally, she couldn't. I fully agree with the doctor's assessment that she would have not qualified into a category where it would have been an exception under the law. 100% she would not. In a state that hadn't banned abortion, Barnica could have been immediately offered other options, including evidence-based care, which would have been speeding up labor with medication or D&E to empty the uterus. Yeah, I mean, I don't even think a D&E would have been offered in most places. She was 9 centimeters. She needed a single dose of misoprostol, almost certainly, to manage this. Texas' new abortion law had gone into effect and required confirmation of absence of heartbeat before intervening unless there was a medical emergency, which the law did not define and wouldn't have been applicable here anyway. That is not an emergency situation. The law did not account for possibility of a future emergency because that would mean all abortion is legal. You can't allow for the possibility of future emergencies. Barnica was technically still stable, but lying in the hospital with her cervix open left her uterus exposed to bacteria and at risk of developing sepsis. Abortion bans put doctors in an impossible position, forcing them to decide whether to risk malpractice or a felony charge. This has been the theme of this whole video, right? Am I not appropriately caring for my patient or am I going to jail? After her state enacted one of the strictest bans in the country, she waited to offer interventions in cases like Barnica's until the fetal heartbeat stopped or patients showed signs of infection, praying every time nothing would go wrong, and that is why she ultimately moved to Colorado. Also worth highlighting here, the lower number of providers you have who care for people who are pregnant, particularly ones who are competent and understand the risks like this person obviously did, the more at risk people's lives become. We have data that shows this. With less healthcare providers in this field in a state, we see worsening of outcomes. And this is happening. There's data on exit strategies, on actual exits from super restrictive states. And I can tell you with full confidence that the discussions in my private groups of obstetricians and Texas obstetricians in particular include endless conversations about how to exit because of risk to your license. But really, I would say by and large, these conversations in those groups revolve around risk to my patients who I won't be able to help, how that affects them, and how that will affect me as somebody who has to live the rest of my life knowing I was trained to save this person's life and I couldn't because the government wouldn't let me. Board of directors opposed the proposal to prepare a report on the risks to the company related to bans in states if restriction on abortion went into place, as they wanted patients to understand services that they could expect and doctors to know what circumstances it would be protected or not. But the board of directors said, no, actually, that's an unnecessary expense and burden and has limited benefits to our stockholders, who, as we all know, are the important people in the hospital systems. Fuck the patients, fuck the doctors, fuck the healthcare system that trains them, fuck the hospital staff that want to take care of them. It is our privatized healthcare system, the stakeholders in the hospital system, and the government that we care about. Thank you and good night. She didn't even end up delivering. The fetus died, and then 40 hours after she originally presented in what would have been the correct medical timing to offer this intervention if she wanted it, she was finally offered it. She delivered after being given medication to speed up that delivery, and she went home 8 hours later, which is quite common in people who have losses. They don't want to stay in the hospital, and if there's nothing else going on, reasonable for them to be discharged at that point. Bleeding was expected, but ended up getting heavier and heavier. She finally went back and couldn't have a visitor with her because of COVID restrictions, and their 1-year-old daughter, oh God, I didn't know her daughter was only 1, didn't have a babysitter. So he left and went home to try and get some sleep. I fully expected her to come home. Oh my gosh. Oh my gosh. Oh my gosh. I did not realize he left and she died. I think I'm gonna throw up. This is awful. So 9 days after her death, while Barnica's husband is processing his shock, this toddler is living without its mother. They're adding information to the medical record, and she added, when I was called for delivery, the fetus no longer had detectable heart tones. She's still worried about prosecution and trying to protect herself, which, fair enough. No doctors in Texas have been prosecuted for violating bans, but the possibility looms over their every decision. Dozens of doctors in those states told ProPublica, forcing them to consider their own legal risks as they navigate their patients' health emergencies. The lack of clarity has resulted in many patients being denied care. 100% accurate. The Texas Medical Board released new guidance telling doctors that an emergency didn't need to be, quote, imminent in order to intervene, and advised them to provide extra documentation regarding risks. But in a recent interview, the board's president acknowledged that these efforts only go so far. The group has no power over criminal law, and there is nothing we can do to stop a prosecutor from filing charges against physicians. Barnica's husband, an immigrant from El Salvador working 12-hour shifts, doesn't follow American politics or the news. He had no inkling of the contentious national debate over how abortion bans are affecting maternal health when ProPublica contacted him. Oh my gosh, he did not even know that this was related to the bans years later. Now he's raising a 4-year-old with the help of Barnica's younger brother every weekend. They take her to see her grandmother, who knows how to braid her hair in pigtails. All around the house, he keeps photos of Barnica so that the little girl grows up knowing how much her mother loved her. He sees flashes of his wife when his daughter dances. She radiates the same delight. When asked about her, he can't get out many words. His leg is restless, his eyes fixed on the floor. Barnica's family calls him a model father. He says he's just doing his best. Okay. That was a lot. Thank you for being here today. I hope that you've learned something. Thank you for listening, and if nothing else, honoring the lives of these mothers who should still be alive. I appreciate everybody's discussion and acknowledgement of how hard it is to feel like we're able to make a difference in any of these situations. I don't think I have anything else to say. Abortion restrictions do not save lives.